The article for this week's broadcast, according to Fierce Healthcare, involves the CMS, which is the Centers for Medicare and Medicaid Services, announcing a new Meaningful Measures initiative. The new initiative will hopefully streamline quality measures. Seema Verma is the administrator of the agency for the CMS and states the new approach will have meaningful measures. The goal is to move away from a fee-for-service system and to add more value and quality. So how do we define value and quality then? After interviewing Mary Whiteman, the Senior Quality Manager and Wellness Innovator at OSU East Medical Center, I realized how many different metric systems we report to. We can report up to 130 different measures. Do all of these actually contain quality and value? Do they improve patient outcomes? Well, according to Seema Verma, these new meaningful measures will involve core issues that are most vital to providing high quality care and improving those patient outcomes. The focus will be on outcome-based measures that will give providers more flexibility and innovation and patient engagement. It will also minimize administrative burdens and decrease unnecessary paperwork, all while increasing the effectiveness. The overall vision is to put patients first and give providers more time with their patients instead of all this paperwork. So these new measures are in conjunction with the CMS launching the Patients Over Paperwork initiative. Nearly 36 healthcare organizations are working with the agency to help spot areas where regulations could potentially be streamlined. Some examples include the American Hospital Association and the American Academy of Family Physicians that are working with the CMS. So the U.S. health systems are expected to comply now with 629 mandatory regulatory requirements and spending $39 billion a year to meet these expectations. On average, this requires 59 full-time employees, which can also include physicians and nurses that are trained. This requires time, money, and resources being taken away from patient care. So hopefully these new measures will improve in all that areas. So some key points I noticed from Seema Verma's recent speech at the Healthcare Payment Learning and Action Network Fall Summit is she wants to start to peel back the layers of the CMS. And before rebuilding, make essential steps to make sure that that paint actually dries and sticks. So the CMS will be asking these specific questions. What's the purpose? Is this required by Congress? Does it make sense? Is it duplicative? Does it meaningfully impact patient care and safety or improve patient outcomes? Why do we have this regulation? So all those questions will be asked so we can evaluate to make sure all these measures are effective. She admits that they have too many measures now with the wrong focus. She's hoping to make those changes. So with changing the focus and the vision, there will be a sustainable system that puts patients first. Thank you.